There's going to be some really big changes coming in the Medicare world, especially in 2025, that if you are a Medicare beneficiary, you're going to want to be aware of, specifically the Medicare Advantage space. And I'm going to talk a little bit about that in today's video. My name is Jamie from meetjamie.com. I created this YouTube channel to help people understand how the Medicare program works, because the best thing that you can do as a beneficiary is understand the program, know how it works, so that you're empowered to make the right decision for you. And this is one of those situations where I want to use my channel to help make people aware. So if you haven't subscribed already and you enjoy content around Medicare, make sure you subscribe to the channel. All right, let's get into today's video, and I'm going to share a couple news stories with you today that are kind of breaking news here. So this first one is from Newsweek, and the title of it is "Millions of Americans May Get Their Medicare Advantage Benefits Cut." So if you scroll down and ignore all the ads, what you'll see here is it says millions of Americans on Humana's Medicare Advantage plans could see their healthcare benefits cut after the company makes major profit-boosting adjustments to its plans. Humana said it would be ending some plans and cutting benefits for patients in 2025 as it hopes to boost its financial performance. Listen to this, altogether 6 million Americans are insured through Humana's Medicare Advantage. If you scroll down, there's a quote here from Michael Ryan, a financial expert, and he said, "The insurer recently warned that rising healthcare costs are squeezing their business model, forcing them to slash benefits and potentially exit some markets altogether in 2025. And by the way, I'm going to share two articles with you today, and I'll leave links to both of them in the description of the video if you want to look at them yourself. So what's happening here is kind of a perfect storm. You're seeing some regulatory changes from the Center for Medicaid and Medicare Services, CMS, that is going to change how insurance companies are compensated on the Medicare side. But then you also have this incredible inflation problem in our country, and we're all feeling that. And I know even for myself personally, with my insurance policies that I have, this year I've seen a jump significantly in the premiums on these plans. And so this is a ripple effect of what's happening in our country, both because of monetary policy, but also what's happening in CMS, the CMS world, the Medicare world. And again, this is something that you're going to want to be aware of. So let's jump back down to the article and just look at a little bit more of this. So it says, a few weeks ago, Humana warned that its 2025 profit targets were down due to the upcoming payments by the federal government to Medicare Advantage plans. So if you're not aware of this, the way that Medicare Advantage plans work is for every enrollee that an insurance company has, the government pays the insurance company to manage that person's Medicare benefits. And so that is a dollar amount per enrollee per month. So as you can imagine, if that changes, let's say there is a cut in the amount that would go to the insurance company, and you have 6 million customers, obviously this is a huge disruption that is really going to affect the insurance company, but ultimately the members. And so that's kind of what's happening on top of some of the inflation stuff. It goes on to say Humana joins several other insurers, so they're not the only ones who have said Medicare Advantage payments likely won't keep up with the surging costs the plans take on as more seniors use their insurance for hospital and outpatient treatment. CEO Bruce Browser said, "We acknowledge that the industry is experiencing a dynamic and challenging time that we must navigate." And so if there's a little bit more to this article, it just says, as more baby boomers become eligible for Medicare and profits become slimmer, Humana said patients should prepare for cuts as soon as 2025. So let me show you one other one here, and this is from Fierce Healthcare. and this is from yesterday, so May 1st, says CVS stock tumbles as Medicare Advantage pressures drag Q1 results. CVS stock took a massive tumble in early trading on Wednesday following its earnings report that outlined some significant challenges, there's that phrase again, in Medicare Advantage during the quarter. The company posted a 90.4% medical loss ratio in the quarter, in line with its peers that have substantial business in the Medicare Advantage market. If you skip down, it says United Health Group previously noted an uptick in RSV vaccines in the fourth quarter, which increases costs obviously for them. And then it just talks a little bit more about that. And again, I'm going to leave links to both of these news articles if you want to read them in the description of this video. Bottom line is this: if you have a Medicare Advantage plan, you should anticipate and look for changes coming in 2025. Now, what can you do about that, right? Because that's the most important question. Well, this is why the open enrollment in the fall from October 15th through December 7th is so important, particularly for people with a Medicare Advantage and a Part D drug plan. If you have a Medicare supplement, that is guaranteed renewable. It just rolls from year to year as you pay the monthly premium. But on the Medicare Advantage and the Part D side, this is the opportunity that you have in the fall to understand how your benefits are going to change for the coming year and adjust accordingly. And you would be shocked how many seniors do not take advantage of this open enrollment. Most of them stay put in the plan that they have. They don't read about the changes because, by the way, every carrier has to notify you of how your plan will change in the coming year. And it usually happens in August or September, so late summer, early fall. You would be shocked how many people don't review that letter. They don't look at it. And they don't look at how their benefits are going to change. But the open enrollment period is the opportunity that you have to change your coverage to align with your needs. The next thing I would say is make sure that you have an independent broker that you're working with, whether it's someone locally, or I know some of you who watch my videos are now clients of mine, or maybe you use another YouTuber agency. Make sure you're in touch with them. Make sure that you're talking to them and asking them, how is this change going to affect me in 2025? And be prepared if you need to change your plan. And that may require changing your doctor because, again, Medicare Advantage plans, you have to stay within the network. But you have options. And the best thing for you to do is to stay informed. You want to stay informed. This is why you need to subscribe to YouTube channels like this so you can understand what's going on. If you have other questions about that, feel free to leave them in the comments below. And if you enjoy videos like this, hit the like button, subscribe to the channel, and I'll see you on the next one. Have a great day.